Many women come to the hospital today expecting to get an epidural in labor for pain management. Are you planning to get an epidural? And do you understand the benefits and risks of getting an epidural in labor? Hi, I'm Susan White. I'm a certified nurse-midwife, an author, and a childbirth educator. I'm here today to discuss the advantages and disadvantages of getting an epidural in labor. So how does an epidural work? The anesthesiologist will place repeated doses of local anesthetics and narcotics into the epidural catheter, which is a small, tiny catheter that goes into your lower back, and that goes into the epidural space of the spinal area. So let's talk about benefits and risk. Benefits, obviously good pain relief, right? So you have continuous pain relief, which causes numbness from your waist down, so you're not able to move your legs. Disadvantages or risk. There is a possibility that sometimes you may not get good pain relief with the epidural and may be incomplete, or there may be one side that's not getting good pain relief. Usually the anesthesiologist is able to correct that. Now, with an epidural, it will take away the pain of the contractions in labor. It does not take away the pressure, however. This can be a good thing because that can help you push when it's time to start pushing the baby out. A lot of women don't realize that you do need maternal monitoring more often if you have an epidural. So that means you'll have continuous fetal monitoring and your vital signs will be taken a lot more frequently. So that's your blood pressure, your oxygen saturation, your heart rate. And some facilities also require you to have cardiac monitoring as well. With an epidural, you probably will not be able to empty your bladder on your own, which means you may have to have your bladder emptied with either a continuous catheter placed in there or an in and out catheter. Another disadvantage is that mom will need help to change positions. Now, she's unable to get into the upright positions like walking or standing. And we know from the research that with upright positioning, labor progresses quicker and moms actually report less pain. Now, it's controversial if epidurals actually slow down labor or increase the risk of C-section. We know it definitely, though, causes the second stage of labor to be longer. And that's the part where you're pushing the baby out. That is due to the fact that with an epidural, it's hard to push effectively. The way that some physicians and midwives like to deal with that is to have you do what's called laboring down, which means the baby's descending on its own without mom actively pushing. Another option is to actually decrease the epidural a little bit so that mom still has pain relief, but she's feeling more pressure to be able to push more effectively. Now, we do know from the research that with a mom getting an epidural, it causes mom's oxytocin to be decreased. That is the natural hormone that causes labor contractions. So if that's decreased, what happens next is that mom may need Pitocin. That's a synthetic version of oxytocin. And you may have heard of that if you've had friends or family members that had their labor induced. That's with Pitocin. It has its own risk, by the way. Now, this is a really cool, interesting research that just came out in 2020, looking at first-time moms that got epidurals. And what they found, they did have an increased length of labor. They did have an increased need for getting Pitocin, like we just discussed. Also, those moms had a higher risk of needing to get a vacuum delivery or forceps delivery. Now, this is the cool part. Women that did not get an epidural reported that they were satisfied with pain relief just as much as the moms that got an epidural. So, now, they also reported decreased breastfeeding rates at 3 months in the moms that got epidurals. And you may think that sounds strange, but there have been more reports in the literature recently that we're seeing that moms with epidurals have decreased breastfeeding rates. Another problem that can happen with epidurals is that mom's blood pressure can go low, hypotension. Now, we try to prevent that with mom getting IV fluids before and during the epidural, but sometimes it can still happen just because of the medications in the epidural. If that happens, that could also cause the baby to have fetal heart rate decelerations. If that's not corrected by mom getting more IV fluids, sometimes they also give medications to increase mom's blood pressure. If all that doesn't work and the baby's heart rate's still having decelerations, there is an increased risk for C-section at that point. Epidurals also have been known to cause mom to have a fever in labor, and it's not that she is getting an infection, she just has the fever, and they're still researching why that happens. So, okay, you've heard the benefits and risks. What if you decide you want to check into other options? There are other options for having your baby. You can consider being unmedicated, which means that you will need to prepare, probably take classes, learn relaxation and breathing techniques, and comfort measures and positioning to deal with your labor. There is another option of IV narcotics or nitrous oxide, which is like the laughing gas they give at the dentist. Both of those do have disadvantages and risk as well. So now that you understand the benefits and risks of getting an epidural in labor, I want you to feel empowered that you can go use this information to discuss your options with your physician or midwife to make your choices for childbirth. If you like this content, please click like and subscribe. Also, check out my website link in the description below to find out more about our childbirth classes. And if you would like other content about other subjects, please put that in the comments so we can make some future videos. Thank you. This is Susan White with Childbirth Education for the Christian Family.